As Australians, we assume free access to medical care is a given. But rising costs and the demands of the pandemic mean the health system as we know it could be on the verge of collapse. Doctors are calling code red.
The way things are going at the moment, we're expecting in the next 1 to 2 years that a lot of GP clinics nationally will start charging. It's becoming more of a national crisis.
Currently, when you visit a GP, bulk billing means the government picks up the tab, but the tab is closing.
Medicare rebates have never kept up. Since the pandemic, the costs involved in running a medical clinic have gone through the roof. The Medicare rebate should at least be double what it is at the moment.
And as that cost gap grows, many GPs are notifying patients they're ditching bulk billing, leaving patients facing hefty bills. Without bulk billing, a standard $86 appointment now leaves a patient more than $45 out of pocket, with the rebate just under $40.
We have seen fees skyrocket for those who pay gap fees, which is about 1 in 3 Australians. The average gap fee to go and see a GP now is more than the Medicare rebate itself for the first time in Medicare's history.
I have family members with kids that have struggled with that.
I have to say it's an emergency to get in pretty much, with the kids.
You're just scared to go to GP because you have to pay. I think that's not right.
Experts fear already stretched emergency departments will be flooded with non-urgent patients unable to afford GP care.
We're not insisting that we're not getting paid enough. That's not the discussion. What we're saying is that if the rebate is not increased, vulnerable people who can't afford medical care are going to be left behind. The elderly and pensioners, people who have mental health issues, people who are unemployed.
A government task force has been set up to find out why basic healthcare is becoming increasingly unaffordable.
We've got to turn this around, because if general practice is not thriving as a centrepiece, a backbone of our health system, we're going to see some terrible consequences.
But with a healthcare system on life support, can it be saved before it's too late?
Well, Dr. Caroline West has been a GP for 30 years and she joins us now. Caroline, there are still clinics that do provide bulk billing. How do those clinics manage to provide care when others can't?
Well, first up, I think that they're certainly facing extinction, those 100% bulk billing clinics. And certainly if you're out in the bush, it's very hard to find a bulk billing doctor. But I think that they're under enormous pressure to deliver rapid turnover consultations, what we call sort of 6-minute medicine. And it makes it very hard for them to then allow time for the longer consultations with more complex care needs for certain patients.
Well, some people have suggested today that this is GPs just wanting to be paid more money. Is that true?
I guess a lot of people would be thinking that, but I think it's really about sustainability here. We have this wonderful opportunity to make sure that primary care, general practice really stays at the centre of community health. And what we're facing at the moment is sustainability issues. It's simply not viable to run a practice with so many overheads when the rebates are only inching north. The last increase in rebate for a standard consultation was only 65 cents, which is a tiny amount in terms of running a practice. So we're really facing a problem with rising costs and the issue around sustainability of practices.
Will removing bulk billing only make GPs' jobs harder down the line because people might not come and see them at those early stages?
I think so, and I think that the patients are really going to suffer here. I think that bulk billing is a wonderful model. We just need to get it right, and particularly for those people who are in vulnerable situations who can't afford the gap. The last thing we want to see is that people only go to see the doctor when they can afford to see the doctor, not when they need to. So we really need to encourage a model where people can access healthcare when they need it at those early stages, and that's where GPs are so valuable.
I was really surprised today to read a GP saying that she got more of a rebate from doing 4 vaccination jobs in the space of half an hour than speaking with one patient about their mental health issues, and that's completely out that equation.
The way the rebates work is really not a fair model at all. So mental health conditions are our number one chronic condition at the moment in Australia, and certainly off the back of COVID, a lot of people are struggling. If you're a GP and you see someone for mental health, that's a consultation that takes time. But the rebate system is set up to really encourage the speed of the consultation, not the quality or the complexity of the consultation. So it means that some people are going to miss out because the system has been designed to accommodate a rapid consultation, not a longer one. People certainly get penalised when you put in the extra time, and GPs are really feeling that, and patients are too.
Well, big road ahead, Dr. Caroline. Certainly haven't solved it tonight, but good to chat. Thanks for your time.
Thank you.